So Mia's asked me to talk about climate crisis and is the climate crisis a health crisis? I think to this audience that's a very obvious answer, right? The answer is of course yes. So, but let me dig into why this is so. Let's just figure out how to change this. I'm trying page down, doesn't work. I'm trying arrow down. Okay, there we go. So I think Nick, and thanks very much Nick for the context, not only of Bhekisisa's evolution since its birth, but also the context in which we currently live in. There are many challenges facing our planet, and I think as many people have said before me, there is no planet B, even though I think people like Elon Musk and others think Mars might be planet B. But I think for this generation, for us, I don't think there's going to be another planet. There are many challenges, but I think these four on this slide probably are the most important. We have significant conflicts currently around the world and suffering. We have unending inequalities. We have had pandemics. We still have COVID, long COVID, and we have, of course, which has been with us for a while, but I think we're beginning to realize it more now than ever, climate change. So Evans and Munslow put together, I think, a very nice slide that shows why climate change is important for health. And this slide basically shows that there isn't really a part of the health system and health outcomes that various climate challenges does not touch. So it's everything from the more commonly known malaria, through to respiratory diseases, through the cholera, malnutrition, forced migration. And I think we have to look at what's happening in the so-called arc of Africa, just south of the Sahara. As the desert moves further south, we're going to find more and more people moving south and more conflicts over grazing grounds as well as water. So the conflicts in Africa are likely to increase as a consequence of the desertification of North Africa. Nick spoke about extreme heat. There is an enormous amount of literature on the impact of heat on pregnancy and neonates, and of course on mental health. And we'll talk a little bit about each of these as we go forward. I think it's true to say that Africa is probably going to be the most vulnerable continent to climate change. The World Bank suggests that 42 of 48 countries in sub-Saharan Africa rank amongst the most at risk for negative health outcomes associated with climate change. So we've got a fairly huge task on the continent to figure out how to both adapt and mitigate the impact of climate change. As Nick said, the impact of climate change is gendered. It has a greater impact on women, including subsistence farmers, women-headed households, and there's also, of course, the biologic vulnerability during pregnancy. Significant impact as well on the most vulnerable in our society, children and the elderly, especially in the African context. Now, Nick has already referenced some of the challenges we can learn from, and clearly, HIV has been a major global epidemic, and I'm quoting here from all the UN AIDS data from 2023. I won't go through all of the numbers here, just to suggest that almost 86 million people became infected with HIV since the epidemic started, with more than 40 million having died from the epidemic. And when we talk about ending AIDS as a public health threat by 2030, we need to realize that we will have an enormous number of people living with HIV and all of the chronic conditions as they get older in 2030. So AIDS and HIV is not done by 2030. And I think that narrative that we will end AIDS by 2030, I think is a rather problematic one. I mean, I can't understand why we want to set up these kinds of ambitious targets, but it's really a misnomer to talk about ending AIDS as a public health threat in 2030. We still have over 1 million people being infected by HIV annually, and over 600,000 die annually from HIV-associated illnesses. I mean, the good news is that we have antiretrovirals at work, but the bad news, as Francois and I heard repeatedly last week, we both were in a meeting, a couple of meetings together, a significant number of people stopped taking their treatment within 6 months of being initiated on antiretroviral treatment. So we've got to do more and we've got to do better. So this is HIV deaths per 100,000, and you can see that across the world it's significantly lower, but the problem continues to be in our part of the world. And this is COVID deaths, 6 million by at least our world in data counts, cumulatively from January 2020 to date. And you can see that it seems like Africa escaped, and there's been a lot of controversy over the data. Whether we believe this data or not is another matter, but there seems to be a little bit of resilience reflected, at least in this data, in our context. But as Nick said, the COVID-19 pandemic has and continues to impact on a number of features of modern life. So let's move on to this WHO figure, which shows the impact of climate change. And the top part of this slide really focuses on our vulnerabilities. And you can see our vulnerabilities relate to both demographic and geographic, biological, and socio-political factors. The exposure pathways are a couple of things that Nick has already mentioned. Extreme weather, heat, poor air quality, water quality and quantity, food insecurity, as well as vector distribution and ecology. And then on the extreme, well, left-hand side of the slide is the vulnerabilities of the health system. Our health systems, at least in sub-Saharan Africa, are incredibly vulnerable to many shocks, as we've seen through the HIV epidemic and the COVID pandemic. And we will see more of it through the climate change and its impact. So we've got to think about whether we have the right leadership and governance, whether we have the right workforce and they're well trained, whether we're providing health information to people, whether we have the essential medical products and technologies. And we saw during COVID that Africa was last in the queue to get either test kits, diagnostic kits, or therapeutics, and of course the vaccine. Whether the service delivery platform has been well set up, and whether we have the financing. Now on the financing, I think it's true to say that we have a crisis of financing in the health sector currently, both public and philanthropy as well as the private sector. And then at the bottom of the slide, we can see how extensive climate change impacts on health outcomes. And the WHO reckons that between 2030 and 2050, climate change can result from upwards of 250,000 additional deaths annually from things like undernutrition, malaria, diarrhea, heat stress, with poor countries being the most vulnerable. So in terms of infectious diseases, this slide basically shows what the pathway from climate change to infections are, and what the intermediate factors are, both as far as the pathogens are concerned, the vectors, as well as the host, meaning the context in which people live and recreate and die. And we will see additional vector-borne diseases, additional food-borne diseases, as well as waterborne diseases. And I think we all know that we're going to see malaria where we've not seen it historically with climate change. And this slide basically shows that the use of satellite imagery can start to figure out where we are likely to see additional transmission of malaria through the migration and changing habitat of mosquitoes. And the key issue is, what do we do about it? And I think this slide starts to show that we should start looking at land use, start looking at the issues around housing, agriculture, what we do, how we irrigate, and how we deal with water sources. Moving on to diabetes, I'm sure people know that if you are diabetic, you are between 2 and 3 times more likely to acquire TB. So there's a relationship as well between diabetes and TB. But in just this slide, there's a number of ways in which climate change, especially heat exposure, air pollution, as well as change in the virus and the host and the host interactions, can impact on people becoming additionally vulnerable to diabetes, with increases in both morbidity and mortality linked to related outcomes like heat-related illnesses, cardiovascular diseases, kidney failures, etc. So the pathways through to these conditions, both on the morbidity and mortality side, are mediated through a number of factors, and in this instance includes diabetes. This slide, which I thought was quite a useful slide because it shows us what we need to worry about and what we can do about it. It shows what people with diabetes should be doing, what clinicians and public health professionals should do, as well as policymakers, to ensure that we increase the resilience of people to changes in the climate, especially those with diabetes. I dare say that many of these things can be applicable to people with TB, HIV, etc. I won't go through, in the interest of time, each of these bubbles, but just to say that there are things we can do about both adapting and mitigating the risks at a population level and at an individual clinician to patient level. The pathways between climate change and TB are quite well illustrated, I think, in this systematic review of 53 studies on the known risk factors of TB that was done and published in 2022. So 9 of the 12 studies found an association, and I must underline that, it's an association between climate change and diabetes. 8 out of the 17 with undernutrition, 4 out of 5 studies with increased overcrowding, and 12 out of the 15 with poverty, and 1 out of 3 studies on indoor air pollution. So all of these things are known risk factors of TB acquisition, and we've known it now. We're not doing much about it currently. It's going to get worse, and we need to figure out what we do about it with some pace. Just to say about TB, the World Health Organization will be releasing the global TB report later this afternoon, and we will see whether or not there have been any improvements post the COVID period on TB incidence rates, mortality rates, as well as prevalence. The relationship between HIV and climate change is still under some discussion. It's not as clear as it is for malaria, for diabetes, and for TB. But this is a slide from UNAIDS, and it shows the relationship between what the UNAIDS calls the climate change complex and HIV. And at the bottom of the slide, you can see that both social disruption as well as immune impairment are what's most directly related to HIV acquisition. And it's mediated, of course, both these are mediated by climate change through a number of pathways. So the pathways are quite numerous and aspect of the association between climate change and HIV. In terms of mental health, there's a fair amount of work now being done on the relationship between mental health and climate change. There are both environmental and institutional factors, and these relate to access to mental health services, and we know that mental health services has historically been the Cinderella of the health system. So even when we have a poor health system, we have an even poorer mental health system in most countries, including countries in the north. The next are what's called social and behavioral factors, and of course there are the drivers, the climate drivers, which are increasing temperature, precipitation, and increasing sea levels, with the concomitant rise in at least two things, and that is significant what's called eco-anxiety and eco-depression. And I guess we can talk a lot more about that as we go forward. And it seems like from the literature that young people are more impacted by climate change and its impact on their mental health than older folk. And I think we can guess as to why that is the case. So, there's a lot of buzz, including in the Gates Foundation, around AI and its application. And I thought, let me pick one slide that shows whether AI can help us at all. And this slide by Jane and others that was published earlier this year shows that AI can be used in a number of ways, and different AI technologies can be used in a number of ways to look at different applications. And I'll just focus on the applications. It can be used to inform climate policy and guide adaptation strategies. It can be used to monitor deforestation and guide land use planning. It can be used to engage the public in climate action and advocacy, and it can inform land use planning and management, including urban development. There's a lot of interest now in urban development with significant movement of people all over the world, from rural and semi-rural areas to urban areas, and we've got to think differently about urban health. I was in India a few weeks ago, and in Mumbai, there's a big push to rethink the way in which urban health is practiced in Mumbai, for example. And I think we'd be well served in the South African context to think about urban health differently as well. So it's very clear that we need to invest more in mitigation and adaptation. Of course, mitigation is probably more difficult than adaptation. And I think for the most part, many people would suggest that we should invest more in mitigation. EA suggests that a 7% increase in investment in both mitigation and adaptation to achieve a clean air scenario could result in saving 3 million premature deaths worldwide by 2040. Now, this is a very important issue for us. We know that Eskom and Sasol are amongst the biggest polluters of our air. And if you look at air quality north of Pretoria, you will know that in the Witbank area that it's causing significant death and mortality. Yet we're doing very little about it, truth be told. The United Nations Environmental Programme has this to say about what we can do to adapt to climate change, and they provide 5 key things that, in their view, can be helpful. One is early warning systems, so better surveillance systems, and they quote Bangladesh that over the last 40 years, they've been able to use proper surveillance to decrease deaths from the cyclones that they experience annually. And they've been able to decrease by 100-fold the number of deaths over a 40-year period. Now, that's a very significant number, and I think we can learn something from that. Secondly, ecosystem restoration, and that is around urban forests, and that's important for cities like Johannesburg. That forest cools the air and reduces heat waves. And I found this statistic quite incredible. A single tree provides a cooling effect of 2 domestic air conditioners running continuously for 24 hours. So we've just got to plant more trees. And there are a number of initiatives that are focusing on planting more trees. The next is climate resilient infrastructure. These, to withstand floods, cyclones, etc., etc. And these include roads, bridges, power lines, and of course health facilities. Now, I was in Malawi not so long ago, and I saw the devastation of Cyclone Freddy on the health system in Malawi. It is significant. Now, Malawi does not have the wherewithal to replace those facilities, even though the facilities, one would argue, were not proper in the first instance. So we need to figure out how to develop climate resilient health facilities as well. there are current wars all over the place around water. They are going to increase as we move into the next century. And UNEP suggests that by 2023, I won't go to the slide. The thing about this, at least when you look at it from the health system, is that it builds around the World Health Organization's building blocks of finance, leadership and governance, workforce, health information systems, provision of essential medicines and technologies, as well as service delivery. And it builds that out in terms of what needs to be done to both mitigate and adapt to climate change. Now, where is the health department? And Bono is here, and she can tell us later where the health department is. Now, the health department, fairly early on, developed a climate change and health adaptation plan for the period 2014 to 2019. How many have seen this plan? I would be surprised if 2 people in the audience have seen the plan. But it exists, it's on the website. Now, Bono tells me, and I know that it's true, that the department has been working very hard over the last 2-3 years to revise the plan. And we hope, Bono, that we will have a new plan sooner, and that it's highly socialized with communities, so that communities not only know what's in the plan, but know what their roles are in implementing, in helping to implement the plan. If we don't have this, we're going to be significantly worse off. Then I looked at, what research is the National Department planning to do around climate change? And I looked at the National Health Research Strategy, research priorities for health for South Africa 2021 to 2024. And I must say I was highly perturbed to find just one thing that relates to climate change. And that's on the slide. Under a title called Burden of Disease and the Social Determinants of Disease, there are these 5 things: intersectoral collaboration, traditional medicine, health inequality, environmental health, i.e. air and water pollution, and nutrition. Now, all of these things are important, no question about it. But where is climate change and its impact as a research priority of the Department of Health? Now, remembering that this strategy was developed by a group of eminent South African researchers, not just the Department of Health, who put this plan together. So we have a small problem, Mia, that we are not, as far as at least what's on this slide, we are not taking climate change and its impact on health as seriously as we should. And the question is, why not, and what can we do as a community, public health community, as well as Bhekisisa, to put climate change more firmly on the radar of the Department of Health in this instance. But I dare say this is probably true, Bono, of most government departments, not just the Department of Health. So I'm going to conclude on what are some of the roles of health practitioners. Quite curiously, Mia, last year, I was asked to talk at UCT to a group of surgeons about climate change and its impact on health. Right? And I, of course, looked at the literature and I found a fair amount of things that can be done in theatres to reduce the impact of climate change. On when do you switch an air conditioner on and off in a theatre? How much of consumables do you use? How much of plastic do you use? Easily in an operation, you can walk out of that operation, depending on what op it is, with 2, one of these black bags that we use for garbages, filled with the disposables, right, from an operating theatre. And of course, the anesthetic gases are also contributory. So most research suggests that the health sector contributes between 4 and 5% of greenhouse gases. So that's not insignificant. So, we should also start in-house to try and figure out how within the health sector we can decrease our carbon footprint. And it's around transport, there's a lot of transport use of plastics and consumables, as I said, air conditioners, anesthetics, etc. And I think we need to use the practical examples to show how we as a health community can also be climate and planet friendly. And as we know, beef and dairy production is a major contributor to greenhouse gas emission through methane. So one thing we can do is at health functions, meetings, etc., we can really offer plant-based foods rather than meat products as one example of how we can contribute. I can say that because I'm a vegetarian. So in conclusion, climate change has already and will continue to have a significant impact on health outcomes. I think there's no doubt about it, except of course there are skeptics out there. Some of the pathways between climate change and health outcomes are direct, others are associations, as I suggested. What's true though is human activity is related to changes in the climate, which means we can do something about it. That means we need to act and act with a greater degree of urgency. The health sector, as I said, is responsible for greenhouse gases like other sectors, and we need to play our part as well. And we need to do more to show the impact of climate change on health at all levels, but especially at community level. My sense is that we don't have in our country yet the kind of community activism that we've had for climate change, Yet climate change will impact on HIV, will impact on TB, will impact on malaria, will impact on non-communicable diseases, etc. So I do think that the health community, we owe it to our communities and ourselves as health professionals to engage far more substantively in community activism around climate change. I also spoke quite incidentally a couple of weeks ago to the ONG forum on climate change and its impact on mothers and neonates. So there is a growing interest in the specialities to think about it. But as public health folk, I don't think we're doing much, and I think we can do much more. So let me stop there and thank you very much for the invitation.